So your OB is telling you that they want to start your induction with a gentle medication. And those two medications are either Cytotec or Cervidil. Cytotec is a pill that you take orally. Cervidil is a suppository that you insert vaginally. I hear this a lot when patients don't want to go straight to Pitocin. They want to start gently. They don't want to start with the IV. They want to start as naturally as possible. And I'm here to tell you the risks to these medications outside of the medical risks, okay? There is risks to every medication, but to me, the risks with Cervidil and Cytotec are much more psychological. When you are given Cytotec, you are administered this medication every 4 hours for up to 24 hours. So right off the bat is a red flag for me because especially if you start in the middle of the night, they're going to be waking you up all through the night. You're not going to be getting a good night's sleep. So that's a number one red flag because when you start labor, you want to be as rested as possible. So you have to be woken up every 4 hours. And the chances of this drug not working are very high. I asked a friend of mine who had a successful Cytotec only induction, which is extremely rare, like meaning she started with Cytotec and she did not end up using Pitocin. I asked her to ask her OB, how many births have you been to besides mine where you started with Cytotec and you did not use Pitocin? And she said 0. So that means at every single birth where they started with a gentle induction measure like Cytotec, 100% of the time, except for this woman, they also used Pitocin. The second risk for me is because you have a 24-hour clock that you administer this drug, it's buying you days in the hospital. So if you don't want to be in an induction for more than one day, starting with Cytotec is not my advice as a birth worker, as a doula, because once the 24 hours is up, if the Cytotec has not worked or it's barely worked, it's dilated you to 2 or 3 centimeters, then they're going to start Pitocin. And then you have a whole nother long period of time for the Pitocin to kick in and dilate you. Now, some people are really lucky where Pitocin works extremely fast and they dilate very quickly, and that's awesome. But by and large, especially first-time moms, when you administer Pitocin, when you are very minimally dilated, it's going to be another 8, 10, 12 plus hour process. So think about that. How long do I want to spend in the hospital for an induction? If the answer is under 24 hours, I would not start with Cytotec. Cervidil is the same thing, but rather than administering it every 4 hours, you just put it in one time. And then again, it's like a 12 to 24 hour window of did this work or did this not work? So it's just buying you days in the hospital. So think about that before you say yes to a gentle induction measure.